What does it mean to have PBC? Let's start with some PBC basics. What is it? What are the symptoms? And why did I get it? Well, let me tell you. PBC is a chronic and slowly progressing disease that results from the inflammation of the small bile ducts in the liver. For some people, the inflammation leads to scarring, which may, after many years, become extensive and lead to cirrhosis. In many cases, people are shocked, surprised, or scared by their PBC diagnosis. They ask themselves, what did I do to cause this? What could I have done to prevent it? Did I make bad lifestyle choices? It is very important for you to understand that you did not do anything to cause your PBC. PBC is not the result of lifestyle choices. It isn't caused by alcohol or drug use, and it is not contagious. So far, a cure hasn't been found, but PBC treatments help to slow its progression. With an early diagnosis and a good response to treatment, you can look forward to a normal life expectancy. It is estimated that 1 in 1,000 women over the age of 40 has PBC. Women are 9 times more likely to be diagnosed with PBC than men. But PBC can also be diagnosed in some younger women as well as among men. Even though it is a rare disease, you may be surprised to learn that PBC is actually the most common autoimmune disease of the liver. So, if you didn't do anything to cause it, why do you have PBC? The exact cause isn't really known, but it's thought to be an autoimmune disease where an individual has a genetic predisposition that's triggered by something, perhaps an infection or a trauma, or an environmental factor. If you have PBC, you may also have other autoimmune diseases, such as rheumatoid arthritis, celiac disease, Sjogren's syndrome, or scleroderma. And sometimes there's a family history of PBC, although it isn't that common in first-degree relatives, such as mothers, daughters, or sisters. In fact, the risk of that is probably less than 10%. Some people don't have any symptoms at all when they first learn they have PBC, but generally, there are some common symptoms that range from mildly annoying to severely debilitating. Fatigue and itchiness are 2 of the most common symptoms. You may also experience dry eyes and mouth, or pain in the upper right side of your abdomen. Less common is the yellowing of your skin or eyes, called jaundice. You might also suffer from gastrointestinal problems and have abdominal pain from a buildup of fluid. If you are experiencing PBC fatigue, it can be very difficult for others to understand. PBC fatigue has been described as being so tired it feels like you're covered by a lead blanket. PBC fatigue is independent of sleep and may come on without warning. It may be confused with depression or anxiety. Unfortunately, at this time, there's no known cause or treatment for it. You may also be experiencing itchiness called pruritus. It can be mild or quite severe and has been described as the feeling of bugs crawling under the skin. It is often worse in the evening, and many people experience it on the palms of their hands or soles of their feet. Dental problems are common too, so good oral care is very important. Symptoms might come and go at different times in your PBC journey, so it's important to discuss your symptoms at every visit with your doctor. But keep in mind, when you notice changes in your symptoms, it doesn't necessarily mean your PBC is progressing. Your symptoms are just one part of the story, and there are some very specific tests for monitoring your PBC progress that your doctor will conduct on a regular basis. Part 2 of this video series describes what you can do, along with your doctor, to keep track of your PBC.